Yes, I know you're loving it. Old school. And my resource person loves it as well. I'm in the studio with Dr. Paul Yegbe, consultant urologist. And today we're wrapping up on our series on male infertility. Have any questions, concerns? 0244-340-437. To get in on Ultimate Health, brought to you by Vita. If you're looking for a healthy, easy to digest infant cereal packed with essential vitamins and minerals, one that has omega-3 to aid in the healthy development of your child's brain, then you definitely choose Vita. It comes in 2 delicious flavors, wheat only and a combination of maize and wheat. It's got it all. Many thanks for joining us. This is Ultimate Health on Joy 99.7 FM. Remember, we're live on Facebook and YouTube as well. And for a couple of weeks now, we've been delving into the often ignored or maybe neglected topic of male infertility. And I have my resource person, Dr. Paul Yegbe, in the studio. Doc, thanks for joining us again.
Thank you very much.
And our discerning listeners have been learning maybe literally, virtually at your feet. We've learned quite a lot. And last week we looked at significant or critical events in a boy or a male's life that could compromise their fertility, right? Quite significant and salient. Last week we talked about testicular torsion, the development of the testes, and so on and so forth, and how this impacts on the production of sperm. Today we want to look at problems, if I can say, further downstream. Let's say that the production of the sperm is assumed or taken to be adequate. There could be other problems downstream. So if we could just quickly touch on those, and then we look at interventions.
Okay. Thank you, and good afternoon to our listeners. Sperm formation,
right,
is a very complex issue. And a lot of things that happened during the production of the sperm could have an adverse effect on them.
Okay.
Now, one of the most common one is formation of anti-sperm.
Anti-sperm.
The sperm itself, it's a immunological property.
Okay.
So anything that reacts against it, it forms an antibody to make sure that it counteracts the effect. And in doing so, cause a lot of problems.
So the body itself is producing something that fights or destroys or compromises the sperm.
Exactly.
Anti-sperm.
Anti-sperms.
Right.
So how do they come, and what is the effect on the sperm? The first one is it interferes with the mobility and transport of sperm.
Right.
You know, the sperm in the semen has to shake the tail and move progressively.
Essentially, it has a head and a tail.
And the tail.
And the tail.
The function of the tail is to propel the head progressively forward to a target that we all know about. It also, this anti-sperm can also interfere with the capacitation of the sperm. The capacitation is what happens when the sperm leaves the testis itself and enters the tube. There it gathers energy and other things to make it appropriate for proper fertilization. And this is also affected. Now, even at the point of a reaction with the egg, where the sperm head had to penetrate the egg and fertilize it is affected. Fertilization is affected, and implantation and growth and development of the embryo is also affected. So it's a huge problem. But we want to know, what are the risk factors leading to this?
Risk factors leading to the body producing antibodies or anti-sperm.
Anti-sperm.
Right.
One, this is because there might be a break to the blood-testis barrier. Every organ has what would I call it, a membrane around it which protect it, so that it is not everything undesirable should enter it.
Right.
The brain has it, the testis also has it. So this is affected when there is trauma to the testes.
Okay.
It is affected sometimes when we surgeons do surgery on these testes.
Okay.
It is affected when there is infection of the testes, what we call orchitis,
right,
or when there is varicocele, or even when there is infection of the prostate.
Okay.
And moreover, in some cases, when there is a testicular torsion, a testicular cancer,
okay,
and torsion, it's produced as well.
All right. 14 minutes past the hour of 2 on Joy 99.7 FM. If you just joined us, you're lucky. The program is Ultimate Health on Joy 99.7 FM, brought to you by Yum Vita, a delicious way to grow. Now, the important thing is that we're wrapping up on our series on male infertility. If you have any questions, concerns, experiences, dilemmas, you can share with us by WhatsApp 0244340437. And we're also live on Facebook and YouTube. My guest you just heard speaking is Dr. Paul Yegbe. Am I pronouncing that right?
Yeah, it's right, sir.
Okay. I know sometimes our listeners will say, hey, you were brophilizing the man's name. Yegbe is correct. Right. Okay. And you can send your questions and concerns in, and shortly we'll also activate the phone lines. We're learning of the challenges and problems further downstream. Last week we spent a lot of time, we dwelt on the testes and the production of sperm, but we're learning that even after that production, there are other things that could occur downstream, so to speak. So that's where we are now. Right. So, Doc, these are risk factors.
Yes.
That could compromise the sperm and its functioning.
Yes.
Right. But we will still get some of it traveling down the tubes or the pipes or the channel.
Definitely.
Right.
They travel. Some slowly, some fast.
Okay.
But the integrity of these sperms are not good enough for proper fertilization.
Okay. So these are things, again, that can be ascertained or isolated, determined conclusively through some of the things we mentioned in the earlier programs.
Yes.
Ultrasound,
sperm
analysis, semen analysis. Right. Right. And even last week, I remember there was quite a long one, post-ejaculatory urine analysis related to the retrograde ejaculation. Okay. Right. So these can be determined for men who may have compromised fertility.
Yes.
And you'll be looking along this phases and these channels to determine whether this could be the cause.
Yes.
Right.
So we can even consider, taking it from level to level. We can say, what are the problems with the testis itself?
Okay.
What are the problems, we will call it testicular.
Right.
Or post-testicular.
Post-testicular, right.
So looking at the testicular aspect, varicocele that we discussed the last time,
right,
that is the enlargement of the veins that drain the testes,
right,
stand tall,
which are related to temperature regulation.
Right.
I did my homework.
Good. And unfortunately, it is also related. The presence of it can also create the antibody, as we have also discussed.
Right.
So the varicocele, I'm saying this because a listener asked that he had children.
Right.
And later they said the varicocele. Yeah, it develops.
Okay.
So if it is primary infertility, that is, you have not impregnated anybody before.
Right.
It's about 35 to 40%.
Okay.
Then the secondary infertility, the presence of varicocele, which might make you infertile, is about 69 to 81%.
Okay. So these are due to probably events later in life.
Yes.
That could have affected. Though you were initially fertile. Right. Okay.
So we can also talk of seminoma, which we might literally see as testicular tumor. Then sometimes when children are born, the testis has to move from the abdomen to the scrotum.
Yeah.
Some do not come down. Now those ones who remain not coming down are also problems,
which we discussed in the earlier program,
the last time. And we discussed the effect of mom after puberty on the child as well.
The mumps.
Yes.
Right.
And also, there are some that we do not know the reasons, and we decide to call them idiopathic.
Or unknown cause. Unknown cause. Okay.
Then coming to the pre-testicular causes, these are maybe a poor a hormonal support
to
the testes, or poor general health. And this deals with, most of the time, with lifestyle. And we'll mention few of them. Now, concerning the poor hormonal support, it is known, and it is a genetic disorder which might lead to hypogonadotropic hypogonadism. That is the hormones that are supposed to support the production of testosterone and other hormones to form sperm are not there.
Or malfunctioning, or they are not there at all.
They are not there. They are not there. They are very, very low, and nothing can be done.
So a man with this in this situation lacks these hormones. And I guess these are things we'll address later, if there's a remedy.
Later we'll mention.
We'll mention that.
Then obesity comes tall. As if you're obese, your sperm formation is also.
Doc, say that one again. If you are obese, overweight, you have to, you want to have children. I think you should have to start doing some small exercise to reduce your weight. Weight could be an issue.
Weight is an issue.
In male fertility.
We also have some drugs and alcohol as part of the issue. The drugs, I will be reluctant to mention them because when you do, patients go to hospital now, they will start challenging the doctor.
Refuse to.
This one, doctor
said it can affect.
So we will leave that one to the doctor.
But in your assessment, your evaluation by the doctor, these will all be checked out. If you're on any medication, if you've had any surgery in the past, all of these things will be evaluated.
Then strenuous riding. It could be bicycle or horses. They also have effects.
Does it cause trauma to the?
It causes trauma to the testis itself. And break down the barrier that we are talking about. And we also mentioned the last time that people who do bodybuilding, in order for them to get the muscle bulk that they want, sometimes use anabolic steroids. And these actually suppress the main source of production of hormones that are supposed to support the sperm production. Then another drug, which is virtually not in use, at least in this country anymore. We use it when there is a peptic ulcer disease. They call it cimetidine. Also has a very bad effect. Now, smoking, tobacco smoking. Science has shown that the tobacco plant easily absorb what we call cadmium from the soil and incorporate it in its body. Now, when you smoke, the cadmium absorption in the body is also very easily, and it replaces zinc, which is a very ingredient part for the DNA that form the sperm, which is part of the sperm formation.
So by smoking and therefore taking in, should I say, significant amounts of this cadmium, then you have a mineral deficiency which now impacts on fertility.
Yes, it replaces zinc, which is part of DNA formation to help the sperm formation. So you have what we call the breakdown of the DNA or DNA deletion.
Great. Doc, we'll give you a breather here. 22 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we come alive with all the essential, up-to-date, unassailable health information. We manage to pluck, literally, all the health professionals with the requisite knowledge to share with you, to improve your quality of life and, of course, your well-being. If you have any questions, concerns, we're talking about male infertility. My WhatsApp number is 0244340437. We're live on Facebook and YouTube, kind courtesy of Yumvita, a delicious way to grow. I've got this from Senyo in Adenta. I'll read it out, and then when I come back from the commercial break, Doc will address that. Good afternoon, Norte and Doc. Great topic. Please, I'd like to know how prostate enlargement or defects cause sexual weakness and infertility in men. Senyo in Adenta sends that. We'll come back in a sec after I take a message from Yumvita. a delicious way to grow. Remember, our back to school fair is ongoing. Last day. I know Ghanaians love last day, as they say it. So go there, Providence Center near the trade fair, and catch some of those discounts. They can stay. I'll be back. Don't go anywhere.
Yum, 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 Vita. So good for baby, baby. Yum, 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 Vita. So good for baby, baby. Mm-hmm. Yum, 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 Vita. Yum, 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 Vita. Oh, yum, Vita. Yum Vita, a delicious way to grow. Yum, yum, yum.
Yum, 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 yum Vita brings you ultimate health on Joy 99.7 FM. We're talking about male infertility with Dr. Yegbe, a urologist. And if it's mealtime for baby and you're looking for a healthy, easy to digest infant cereal packed with essential vitamins and minerals, one that has omega-3 to aid in the healthy development of your child's brain, then you choose Yum Vita. It comes in 2 delicious flavors, wheat only, and a combination of maize and wheat. It's got it all. It's called Yum Vita. Grab that for your child. We're talking about male fertility. Remember, we're also live on Facebook and YouTube. So Senyo is asking about prostate enlargement or defects and its impact on fertility.
Now, prostate, from the day you are born, will continue enlarging till you are dead. Then when you are in the grave, it doesn't continue.
Okay.
Now, when we say, so we will want to know what degree of the enlargement that we are talking about.
Okay.
So that one we will not have much to do with it.
Right.
But the defect, if there is a defect, well, maybe, possibly, the secretion that is needed to enhance the fertility is what we must be talking about.
Right.
Now, at any point at ejaculation, there is a secretion from the prostate, which within 20 minutes is poured on the semen.
All right.
So that it doesn't become hard. It maintains the fluid form.
Right.
For the sperm to swim and go and fertilize.
Okay.
So if there is a defect, could it be that fluid is not being produced?
Right. And therefore affecting sperm motility and everything.
Be impaired.
Right.
And the sperm will not be able to swim to fertilize.
Okay, great. Good afternoon, Joy FM. Please, I'm concerned and will be very interested to meet the doctor. Kindly help me out. Francis in Akuse sends that we will help you out, and we provided his number last week, but I can see your number as well. We'll help you out and try to bridge you with Doc Yegbe here as well, so that we can deal with whatever issue you have. This is Chris. He says, I masturbate a lot. But anytime I'm in bed with my wife, I hardly go twice, and it's really affecting me. I don't know whether it's the masturbation or any other thing. Please help me. Doc, any comments on this?
Masturbating. Married and still masturbating. Well, for you to go a second round or not, it depends on a lot.
Okay.
One, the interest to go.
Right.
And the readiness of your partner as well.
Okay.
And the age also comes in. But we do not know.
Right. Your age.
My age.
You know what I mean? When you say the age, the age of the man.
The person.
Right. So in this instance, Chris.
Chris.
Okay. Right. So a few other things need to be brought into the picture for us to be able to give him an answer which suggests whether it's the masturbation or other factors.
But masturbation per se, what it affects is it brings about premature ejaculation most of the time.
Okay.
Maybe we'll have time to talk about these things.
Okay. Right. Good afternoon, Norte. Linda in Osu. Wow, it's been a while. I understand energy drinks are not good for the body, especially the male body. It can cause infertility. How true is this?
Energy drink, is it because of sugar?
And there's so many varieties. Some have caffeine, some have other things. So,
yes. If we are to allow ourselves to go into detail on this issue, we would have seen that coffee caffeine and others, they affect sperm motility.
Okay.
But energy drink, just broadly, well, I will find it very difficult to comment.
Right. We have to be specific. And even with caffeine, we'll be looking at the level of usage and so on and so forth.
The concentration of caffeine
right.
what you are drinking.
Good afternoon. I have a son of 10 years who has one testicle and would like to know what can be done if it has a possible effect on sperm production. This is from Atu. We tackled this last week.
Yes,
yeah.
But what happened to the other one?
Right.
Is it that he has not descended?
Right.
If he has not descended, I think 10 years is going late. He must, as early as possible, get to the doctor.
Right.
But if it has, that is how the child was born, and all investigations show that there is none remaining anywhere.
Okay.
It should not be a problem.
Okay. Right. Loving these questions. Good afternoon. I am Edem. Let's see. Doc, when you massage the penis, does it have or cause any harm to the system? I want to know. Hey, Edem.
System per se, no. But later in life, if you are married, you'll be having premature.
Is it a subtle way of talking about masturbation or self-stimulation when he says when you massage? And I know Edem could be male or female, but
if you say you massage, it's masturbation.
It's masturbation. Right. Self-stimulation. It looks like we'll have to look at this in detail. 30 minutes past the hour of 2. We promised that this week we'll go into the intervention. So we'll switch gear a bit, but we'll still be able to take on board your questions and concerns to Dr. Yegbe here in the studio.
Before we go to that, we haven't tackled the post-testicular aspect.
Right.
I will just mention
yes.
because they will be used in the intervention. So sometimes, like people who have cystic fibrosis syndrome or disease, they do not have the tube that will transport the sperm from the testis to come out for ejaculation.
So what happens to the sperm?
So the sperm remains there, but their intervention will be looking at them.
So you're producing the sperm, they may be in adequate quantity
but
form,
they are not able,
but they are not being delivered because there's no conduit channel. Right.
To it.
Okay.
Then we can also have...
You mentioned something there, Doc. Cystic fibrosis.
Cystic fibrosis.
Okay.
It's a very bad disease, but we might talk about them later.
Okay.
Now, you might also have retrograde ejaculation.
Okay.
And this is very common in people with high blood sugar. Now, when we ejaculate, the sperm goes back and hit a tight or a closed bladder neck.
Okay.
Then from there, it can integrate to come out for us to see. But people with diabetes and people who have had maybe prostate surgery, everything goes into the bladder and remains there.
Okay.
Now, when treatment want to be sorted, sometimes they will want you to bring the urine immediately after sex.
Okay.
Then the sperms are harvested, centrifuge, and the appropriate treatment can be used.
Doc, just so retrograde ejaculation, the sperm goes back and is deposited in the bladder. And then when you urinate,
it comes out.
You have sperm in your urine. Are these sperm viable alive?
Most of the time, yes. Now, if the doctor intends using them, he will want to alkalinize your urine. The alkalinity doesn't affect the sperm so much, unlike acidity.
Right.
So you might be taking some medications which will make the urine alkaline, so that the sperm can easily be
harvested,
collected, centrifuge, and used for the various procedures that we might be discussing later.
Okay.
Sometimes, due to infection or some other problems, you might have your ejaculatory duct obstructed.
Right.
It means that you would ejaculate, but the sperm will not be able to come into the urethra to come out for you to see.
Right.
Now, another aspect of it is people with hypospedia. Hypospedia is the urinary point that we see called external meatus.
Right.
It's not at the tip. It could be under it, any point from under it into the perineum.
Okay.
Now,
so instead of at the tip of the male organ, as it normally is, so that when you urinate or anything, it comes straight out. You're saying that the opening
might be under any part of the
it's in the wrong place, right?
The wrong place.
Okay.
So when you ejaculate,
so that's a structural abnormality.
It's a structural abnormality.
Okay, of the male organ.
Yes. So
right.
when you ejaculate, instead of the sperm being deposited directly under the cervix,
okay,
it might be swimming in the vagina and other things.
Whoa.
The vagina itself is a very, very terrible place for the sperm. That is why most of the time they will tell you that you should have 15 million, 20 million, or 100 million
right.
of sperm in order for one
to guarantee that one
yes,
would meet an egg and fertilize it.
It's not good. So these people might not be depositing properly.
Okay.
Now, to add to this is on the side of the female. We call it deep dyspareunia. It's a very painful thing during sexual acts.
Okay.
Now, God or nature had made it that during sexual acts, when you are going to ejaculate, you bring your partner closer to yourself.
Okay.
The reason is to be able to deposit the sperm directly under the cervix to shorten the distance that the sperm has to travel.
So to give the sperm less swimming to do.
Yes.
Right.
But when there is pain during sex and you're pulling your partner to yourself, it might be pushing you away from her.
Right.
So instead of the sperm being under the cervix, some might pull in the vaginal vault, or some outside. In the wrong place.
So if it was football, it would be over the bar. Let me give. Yeah.
We want to talk of impotency.
Right.
Because the erection should be there before the sperm should come out.
You need an erection sufficient enough for sexual intercourse. Right.
But if it is not there, it's a problem. But I want to state, and it's more of an appeal to my colleague practitioners,
right,
that for a long time, we have never taken the sexual life of our patient into consideration when they come to us in the consulting room.
Right.
And it's not only in Ghana, it's all over the world. But these people sometimes go to the extent of paying an ultimate price of suicide.
Right.
Because they cannot have erection. So I'm thinking that especially in our diabetic clinics, in our hypertensive clinics,
right,
we should try, and after giving the tablets, let's say, oh, sir, how is your sexual life?
Right.
And the people who are the patient should be able to open up so that problems are solved.
So you're saying
if you are giving a hypertensive drug and the person in the house does not have erection,
right,
where is the peace? Will he sleep well?
Okay.
You are not treating properly.
And you're suggesting that
so let's start.
Your colleagues should pay more attention
all of us,
to some of these practitioners
should start
make it a legitimate
how is your sexual life?
Focus of discussion.
Yes, how is madam feeling about you?
Right.
So that we can actually totally and holistically start treating our patients.
Great. Thank you so much. You're just hearing Dr. Paul Yegbe telling us that, hey, the other side of it, I mean, how is it going for you? Are you satisfied? Is your partner satisfied? And if not, what are the issues, right? Because when these issues and factors are neglected, there are other problems. Male infertility on Ultimate Health Joy 99.7 FM. It's great stuff. And we're going to go into some of the solutions. This is from Campbell. Campbell, it's been a while. Great show, Norte, and well done to Doc. Thanks, Campbell, one of our staunch listeners. She's always on the point. I always remember her because she actually went into labor and still was able to call.
Wow.
Right, had a baby, and she'd won a prize on our program, and I wasn't getting her. And then she says, "Oh, sorry, when you called, I was actually in labor." I'm like, "Wow, that is a serious listener." Yeah. But anyway, for my serious listeners, and Campbell always wins something. From next week, we have some giveaway vouchers from Sunshine Healthcare, Excellence in Diagnostics. Yeah, get some of these essential critical tests done at Sunshine Healthcare. And we'll be selecting some of our listeners, and we'll find a way, Abeku and I will find a way to spread that across our WhatsApp listeners and also phone calls as well. Sometimes they say we are biased towards the phone calls. We're going to shift gear right now, and perhaps I'll take a commercial break and then shift gears and look at what can be done. We spent almost 3 weeks discussing the issues, the problems, describing them and their causes, but we must be able to give you some remedies, and that's why Doc is in the studio today. Stick and stay, don't go nowhere. Okie dokie. My commercial says it has some kind of ejaculatory problem. Don't mind me. There you go.
Yum, 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 pizza. So good for baby, baby. Yum, 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 pizza. So good for baby, baby.
Oh, great stuff. Ultimate Health on Joy 99.7 FM. My guest in the studio is like, wow, your listener was what? In labor and able to connect or listening? Or I don't get that. Campbell, one of these days you'll have to come into the studio so we share the story properly.
Exactly.
Yeah, maybe sometimes like a Chinese rumor, you pass it along and it changes. The details were, I was just amazed anyway. But Doc, we've dealt with some of the problems, perhaps not all of them in detail. But the essential thing for our listeners is there help, intervention, remedy, treatment, management available?
There are. And the first part of it that we'll be looking at is the prevention, how to prevent them. So we might stop smoking.
Okay.
Those who are obese should try and lose some weight.
So modify the lifestyle issues. Substance use, weight issues. Right.
Alcohol must be minimized. Moderation is the best. Also, avoid excessive heat to the testes.
Okay.
That is, most factory workers should find a way of not staying in the heat room throughout the day.
Right.
They should go in, out, and out. Then, not scientifically, but some people also think that nylon underwears are sometimes detrimental to the formation of sperm. So if you can wear boxers, if you have fertility problems.
Boxers or cotton.
Cotton is better.
Okay.
Then also, if you are treating infertility or you have a fertility problem, you must stay with your wife.
Right.
Because the concentration of the cell, that is the sperm, is necessary for procreation or for your wife to become pregnant.
Okay.
But if you go here, your wife may be in her menses, then you go and spread and fire, and then you come back.
You come back with what's left.
When she is maybe in the wet season, you might be firing blank ammo. There might not be anything enough.
So if you know you have a problem,
stay at home.
Stay at home and do the work.
Yes.
Don't be
roaming about
doing I don't know what cereal, whatever it's called, right? All right. Great point. Okay.
Then for contact sports, they should use a protective. They should protect the
jock strap.
They should strap them.
These days we don't hear of the jock strap. Cricket and other things, you actually protect.
But we are saying that when there is trauma to the testes, there's antibody.
Okay.
So we should take that into consideration.
Great, right.
Then these days, we do not know very much well about our iPads and the laptops, the energy they give.
The radio waves,
but you see
radiation.
A lot of people putting laptops, iPads on their laps directly over there. I think it should be minimized. And especially for children whose cells are just growing.
Right.
Parents should ensure that they reduce the children's contact with it.
Right.
Or advise them.
Be careful with these gadgets.
Put them on a table.
Convenience could be a curse.
But not be on there.
Right.
Then to my colleagues, the health workers who work in a radiation unit.
Okay.
They should always get protection.
Okay.
To their testes.
Right.
Now.
So all of these are really like external factors, lifestyle choices we make.
We have to make.
And we have control over. Great.
Yes.
Okay.
Now, concerning food, there is no scientific proof.
Okay.
But what we want to say is that eat a balanced diet.
Right.
Take a lot of fruits. Take a lot of vegetables.
Okay.
And leave the rest to go.
Healthy body. Yes, right. Good. Give God less to do where you're concerned in that regard.
Yeah. So I think it should be common sense. the woman should also go and find out if there are some knots she also needs to tie.
Right.
For the forward movement of.
So this quest for, let me say, fertility should be a joint enterprise.
It's a joint enterprise.
Right? You shouldn't be doing it behind your partner and thinking that you're sorting something out. Do it together, and it doesn't matter where the issues are. Remain together in looking for solutions. All right. Now, Doc, I'm going to announce the phone lines, but I guess it would be helpful if we look at the interventions in terms of surgical, pharmaceutical or hormonal, and then maybe any others. Okay. Let me announce the phone lines before you think I'm keeping Doc all to myself. 0302216541, 0302216541. Those are the healthy buttons to push for ultimate health on Joy 99.7 FM. Brought to you this and every Sunday by Yumvita, a delicious way to grow. Now, Chris, who talked about the masturbation earlier, has sent a follow-up WhatsApp. He says, please, he's 30 years old and he's far away from his wife. That's why he masturbates, to feel free and not to cheat on her. But anytime I meet her, I don't have the strength to go the extra round. You know, sometimes they say score in full time, regulation time. Why do you need extra time and penalties? Is the extra round or subsequent rounds, are they more potent in terms of fertility?
Is it sure that after even meeting the wife, he will want to masturbate to get a full joy rather than going to the wife? Because from what I know, those who masturbate,
right,
they find it difficult at a point to even get to their wives.
Okay.
Because they are used to the satisfaction from the masturbation.
So you have a virtual rival.
Yes.
Right.
So you are rivaling your wife. Just keep the thing. Even if it is 1 year, you won't die.
Okay.
Keep
Chris,
it and come and have
we shall be talking, Chris. All right. I got your number here. I've got Ajiman on my line from Tema. Ajiman, good afternoon.
Yeah, good afternoon, boss.
Right. How are you doing?
By God's grace. I hope you're doing well.
By His grace. Yeah, share with us.
Yeah, I mean, we have been enlightened that the doctor has explained very better.
Right.
But I don't know why he's not able to say the fat people should do enough exercise, because some of us who are slim like Abeku, we always do exercises regular.
They're slim like Abeku. Yes. So you've called to make noise. And you're saying the doctor is not...
I want to ask.
Yeah.
Some activities that we undergo, something like inhaling exhaustion, this kind of smoke coming from the exhaust, and also some people, they use their mouth to draw fuel from pipes and what have you.
Right.
It also have effect on the sperm.
Okay, great. I have Oti on my line as well. We'll take some responses and then some more questions, and then we'll come for the responses. Oti, good afternoon.
Afternoon, Oti.
How is it?
I'm fine.
Okay, share with us quickly.
I thank Dr. a lot, but I think today, I think last time, I forgot to pick the number and I mixed it. So I'll pick it. I've married for 5 years.
Yeah.
December will be 5 years. There's no issue. I went in, they say I have a low sperm count and something, so they give me some tablet I'm taking, but I have not seen any improvement. So
okay,
I want to come see the doctor.
Right.
But I want to ask the doctor, I use a earpiece a lot. I have a problem with that because as for me, I'm not really a bad boy. I'm a clean boy. So I don't know.
But you're not really a bad boy.
No, I'm not.
So kind of partially a bad boy.
No. I'm really good boy. I'm not a bad boy.
Okay.
So no. So I don't know why it's coming. Because one of my auntie told me that because it's not come, I should try another lady. I said no. I'm married. I don't want to go that way.
Okay.
Yeah.
All right. So, let me. Okay, we'll get you the answers. Let me take Godwin in Nungwat. Godwin, good afternoon.
Yeah, afternoon.
You're most welcome.
Thank you.
Right.
Yeah, great work done.
Thank you.
Actually, I have one kid. She's almost 8 years now. But as of now, I even try to get another one back.
Okay, so you have one child who's 8, and subsequently you've had challenges.
Yeah.
Right. Okay. So, is there a direct question, or should I just leave it at that for Doc to answer?
Yeah, actually, you can give me the direct question, the answer.
Okay. All right. Okay. So this sounds like secondary, right? The first one, we've got Oti, who says 5 years, nothing is happening. He's been put on medication. He still thinks nothing is happening. So he would like to see you. Your comments on that. And then this gentleman, secondary, should I say, infertility. I have Mike from Asin. Let me just take him and then come back. Mike, good afternoon.
Good afternoon.
Right, you're most welcome.
These days, with so much stress in the system, can stress for life be one of the causes of the problem?
Okay.
And also intensive driving throughout the whole day, traveling all the way to Burkina and back and things. Can it be a cause of the problem?
Okay. Stress and long hours driving, right? I hear we have another caller. Nope. Okay. Right. So, Doc, Oti talked about 5 years of marriage. He's on some program. He's taking medication. He also uses his hands-free or Bluetooth a lot. He wants to know if that could be an issue.
That using the hands-free should not be a problem.
Okay.
But I think that if having treatment is not getting solution,
right,
you should look for a second opinion.
Second opinion. Yeah. Okay. Right. He said he missed your number last week, so he's eagerly waiting for information on the number. Right. There was another one. Now it suddenly slipped me. There was the
about the infertility.
Infertility, and then we talked about second round as well.
Yes.
Yeah. Right. And people want to be able to go multiple rounds. Does that change your fertility profile?
No, it has nothing to do with fertility, but more of erectile dysfunction. And I hope we'll have time one day for erectile dysfunction.
Erectile dysfunction also on our menu. It says, what is whole body vibration? How does it affect male infertility? Whole body vibration. I don't know what you're talking about. This is from Pasmi in Adeta or Pasmi Adeta. Could you please clarify what you mean? We're running out of time, though. Yes. How long does it take to prepare a man for a second round? I'm in the early 40s. Also, how many times is ideal per week? Hey.
These I think it depends on your energy.
Who is preparing who?
That's another issue. I think as much as you want.
Right. If you can and you're able, fine. But if you're not, it shouldn't be a judgment, should it?
If you cannot ejaculate, if you cannot erect,
boys are bred.
The energy is not enough.
Boys are bred. So you rest. But it's not a judgment, is it?
No.
You're not being sentenced.
No.
Please, you're not in trial, okay? Actually, you're making love. So if you relax, I think the second and subsequent ones will come easier.
Come on its own. That relaxed.
Right. Ooh, do penis enlargement pills affect sperm production?
Is there something like penile enlargement?
I'm seeing a lot of things on the market sometimes online.
Okay, but they are things that do not really have effect on the penile enlargement.
All right.
But penis and fertility are two different things. We shouldn't link them together.
Okay, right. How does hydrocele affect the fertility function and size of the penis?
Hydrocele is a collection of water in the scrotum. It doesn't have anything to do with the testis itself.
Okay.
But if you stretch it again, you might say that it affects fertility.
Okay.
But the record is very minimal.
Okay. Right. I have Odas on my line. Let me quickly take him and come back. Hello?
Yeah, hello.
Yes, Odas.
Yeah, thank you. A great Oko. Yeah. What I would like to ask, there are some people, it cuts across society, they have different size of male organ. In fact, there are some who are even, I would say, pastors and religious people.
Yeah, Odas, can you please...
They have extraordinary length of male organ.
Yeah, so what's your question?
Those people, we call some cattle destroyers.
Odas, please, I want your question or I'll have to take you off. Just ask your question.
I think they are better than other men. So, for such people, can we say that their fertility, compared to the ordinary person who has a normal size male organ?
All right. Okay. I think Odas is suggesting a relationship between a correlation between size of organ and fertility.
The size of organ, the fertility and the size is mainly with the testis itself.
Okay.
But not with
the penis. Right. Okay. Straight answer. I know Odas would like to give us a sermon or a lecture as usual. Right. We won't go there. We won't go there at all. Doc, please, can long years of riding bicycles cause infertility in men? Charles Donyo from Nungwa asked that. You'd refer to...
Yeah, we refer to it, but it is the rigorous nature of it, but not the long years.
Okay.
You could ride once in a while for a long time, but that does not affect your fertility.
All right, Doc. We have about 6 minutes left, but let's look at this. So, the surgical means that there's something structural that can be corrected by surgery.
Yes.
So you'd go in there and do some of these things.
So the first one we want to talk about is the varicocele.
Right.
We had discussed it several.
Right. Yeah.
So we should do what we call varicocelectomy.
All right.
It's a way of opening, getting to the cord, and select the dilated veins.
Right.
One by one, and cut them and tie them up.
Right.
Then the flow find another way to come, so that the heat production and the anti-sperm productions will be minimized.
So if your sperm production is okay, but you have varicocele,
yes, there have been situations that you do semen analysis.
Right.
They say the sperm is normal.
It's normal.
But we also talk about anti-sperm, right.
Anti-sperm, okay.
The antibody to the sperm.
Right.
Could it be the problem for the infertility? It could be.
Right.
As long as it has been mentioned that it affects the blood tested barrier.
Okay.
It must be considered.
Right. So it can be corrected surgically.
Varicocelectomy. Cutting of the varices.
Right. Okay.
Then now coming to the transportation.
Okay.
The tubes might block. We can canalize them, dilate them so that they can transport properly. Where there is the tubes are not present.
Right.
We might be asked to aspirate. The epididymal
aspiration means you are harvesting the sperm yourself.
Harvesting the sperm.
Right. Okay.
In this case, then you can use it for whichever way is appropriate.
So you harvest the sperm, keep it.
No, and not keep it, but you can do the intrauterine injection.
Okay.
That is, you shorten the distance for which they will travel and inject it straight away into.
So you take the sperm from the man and then you inject it
straight into the womb.
Right. Okay.
The womb. So that is, we call it intrauterine semen sperm injection.
Okay.
Now, there is another one that is the in vitro fertilization.
Okay.
Now, and another one called intracytoplasmic sperm injection.
Right.
Now, my advice is that God, in His own wisdom, have arranged everything properly, that this is the way they should go. Now, if the sperm cannot function properly, there's a reason for it. Should it be used? So what we, as a country, we might be looking at, if we want to go this way, is to make sure that we have appropriate genetic counseling, genetic profiling, so that even if the parents or the people who wanted the procedure to be done should be in their mind that there might be a genetical disorder which is preventing the sperm to be functional. So when you take them, you should be prepared to have a child that might have some abnormality. And these must be known to all of us, and both the doctors and the people who are going to.
All right. So these are surgical interventions that can be done. Right. Oti suggests that he's been put on some medication or some tablets, he's taking them. So would, for example, if I have some hormonal imbalance or deficiencies, would I be taking hormones orally or?
Yes. The only time that you want to take the hormone is that when you have the hypogonadotropin hypogonadism. That's when you use what we call luteinizing hormone or FSH to replace. Only that one.
So that's a form of hormone replacement therapy.
To enhance formation of sperm.
Okay.
Now, testosterone should not be used.
Okay.
Because, as we discussed the last time, it suppresses the original supplier and weakens it.
Right.
And even worsens the situation, as we discussed about these anabolic steroids and other things.
So these are decisions and interventions that will be discussed with you by your doctor.
By your doctor, and appropriately.
Okay. Good afternoon, Norte. Your discussion over the past few weeks has been very educative. Thanks so much. I remember about 2 or 3 years ago on Tuesday afternoon when the lady called in when she was at the waiting room after delivery. You really have to reward her. This is from Clarissa. Okay. Oh, my loyal listeners. Abeko, we've got to find some money. Maybe we'll have an ultimate health party. Thanks, Clarissa, for sharing that one. You just made my day. So, Doc, these are interventions that are available, right? Of course, premised and based on the proper assessment, investigations, and diagnosis of the problem. And we started off last week by emphasizing that in up to about 40 to 50% of infertility cases are male type. Right, okay. And our discussion has assumed that we're doing all these things on the assumption that the woman is okay, the partner is okay. But in some instances, you will have to also
the partner
investigate,
assess herself,
and
clear, so that time is not wasted.
Okay. I don't know whether it's a good question to ask, but I guess many people want to know. So, is there a good degree? Is it possible to give us an idea of the degree of success or success rate, or it's case specific?
It is case specific.
Right.
Even the varicocele that we are talking about, that it can impede sperm formation.
Right.
It is not a green card impregnation.
All right.
You might do it, but nothing happens.
Okay.
Maybe there is another issue.
So we have to manage expectations as well.
To manage expectations. You don't tell the person that, I'm doing this, and so you have this.
Okay.
From my experience, the textbook says when you do a varicocelectomy for somebody, it takes 2-3 years.
Right.
For correction.
Okay.
But I've had about 2 or 3 cases where varicocelectomy was done. In 3 months' time, there is pregnancy.
Okay.
And interestingly, the men will come to me and ask me, Doctor, is he sure that I'm the one?
Right.
And at a point, I was pushed to the extent that a DNA test has to be done.
Okay.
And it was the man.
Right.
So
sometimes you had the results, but you need to be sure. Right now you've conceived, but somebody is doubting whether it was them.
I'm sure he was too happy that
who fired the real bullet.
The real bullet.
Wow. Okay. Let me also ask you this. I've handled a case where it seemed that the doctor handling the fertility procedures had wrongly, perhaps, maybe unconsciously or unknowingly, given one partner the news that, the fault is from your partner. And this created some tension in the process and in the relationship. How is it managed? I mean, the two of us are seeking something, right? Literally seeking the face of God. But in the investigations, it might come out that, the problem rests on this side or that side. How do you manage that?
First and foremost, the two people must be educated.
All right.
That these are the possibilities in life. It's not the fault of A.
Right.
It's not the fault of B.
Okay. Because Oti mentioned that his auntie had said, try somewhere else. So these things can happen.
They happen.
You accept them. If God brings you to it, He'll take you through it.
Yes.
Okay.
So I feel that the two people should be committed to it. That it is not my force, but it is by nature. So I am with you till the end.
Okay. Right. And then the doctors will know how to handle.
To counsel you properly.
Right.
Before even saying that the problem is from here.
Okay. Great. Doc, last week you gave out your number. I'm very reticent on these things. Would you mind doing us the honors again this week?
Somebody called me.
Yes.
I was like, why are you calling me? They said, Doctor, I didn't call you to talk about the weather. It's about health. So as long as we want people to
let me say this before before you give out the number, that for many of you, you are very anxious. Last week, there was a lady who called. She called me and followed up, and she really wanted to talk to you.
Yeah, she called me.
I wanted to get some preliminary information from her, but she really wanted to know, am I speaking to the urologist? Please, I would entreat you when you call our guests, especially when we make them available to you by phone. Please know that they are busy people. They also have lives, right? And try and observe some due courtesy. Right. Otherwise, sometimes things do go wrong. We all know. I also work in the health sector. Sometimes your number is out there and people are anxious. Right. So Doc is going to give his number, but he was saying something. I felt the need to add this so that when you call and it's not picked up or he's busy, please. Sometimes even a message will do, and we can do the interim follow up. Yes, Doc.
024 280 1237.
Okay, right. 024 280 1237. Right. I've got it off by heart at my fingertips, because we all need help, and we've been given some extra time, so we're gonna reactivate the phone lines. We're supposed to cross back to the school fair. They're doing a little tweaking on our generator so that we can do the external broadcast. So my phone line is active, 0302-216-541, 0302-216-541. I'll just give Doc a breather and come back and see if we can take a few parting shots from you, our discerning listeners. This is Ultimate Health on Join 99.7 FM. Of course, my name is Norte by nature. Stick and stay. Don't go anywhere. Okay, well, my commercial is not playing. I got this one right. There you go.
Yum, 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 pizza. So good for baby, baby. Yum, 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 pizza. So good for baby, baby.
Yum, yum, yum. Yum Vita, delicious way to grow. They bring you
Join the left.
Ultimate Health on Joy 99.7 FM. Listen every Sunday, 2:05, if you're looking for that healthy, easy-to-digest infant cereal packed with essential vitamins and minerals, one that has omega-3 to aid in the digestion, in the development of your child's brain. Choose Yum Vita. It comes in 2 delicious flavors, wheat only, and a combination of maize and wheat. It's got it all, and it's called Yum Vita. Doc, let's ask a few questions whilst we wait for phone calls. Testicular ultrasound. Right. Most of our listeners will know what the ultrasound is.
Okay.
So this is what? Taking an ultrasound.
It's an imaging of the testis.
Right.
So when you take the image of the testis, one, you want to look at, some people want to look at the size.
Mm-hmm.
Are there any abnormalities there? You want to find out whether there is a hydrocele, that is water surrounding there. And moreover, for it to be done, there's a reason.
Okay.
So for infertility, when you are doing a testicular ultrasound, you want to look at the size. Is it within the normal range? If it is not within the normal range, it means that there is some form of atrophy, and the problem that is leading to it has to be solved. And there could be varicocele that must be looked for. And sometimes, rare but is common, spermatocele. Spermatocele is a diverticular of part of the tubes that take the sperm to wherever it has to go and function. Now, so instead of the semen moving, they collect in that area. So that can also be some form of leading to infertility.
So you can use an ultrasound to
ultrasound will
identify
have a look at them
Right.
and other things as
Okay.
well.
We've also talked about, but I think we need to go back over semen analysis. Semen analysis.
Yes.
And a lot of people say, well, semen, is that not the same as sperm? So what is a semen analysis?
Now, semen analysis, maybe let's talk about the collection first.
Okay.
Because sometimes people don't collect it properly.
Okay.
And they don't get the result.
All right. So how and what do you collect for a semen analysis?
For the semen analysis, there are 2 or 3 ways. The first, some years back, they said you should be having sex if you're about to come or to ejaculate. Then you remove the penis and pour it in a tube that has been given to you. But we have also realized that when you do that, there are some part of the fluid that comes initially and needed to be examined as well. That one is not considered. So instead of getting maybe between 1.5 mils to 5,
Okay.
you might have 1 or maybe 2.
Okay.
So the doctor is not is finding it difficult to find out whether there is an obstruction in one of the tubes that is not allowing you to have the normal volume.
Okay.
So that one is discouraged. Right. Now, there are some special tubes or condoms that are used.
Okay.
You can have sex, you ejaculate in it, and you take away.
All right.
But it is not the normal condom because the normal condom has anti-spermic
spermicidal
inside, so it kills the sperm.
Right. So
you
you'll be given a special condom to collect.
Then another, which I think is the best one, is to masturbate.
Right.
And just have it in the tube.
So when
it must be done in the clinic.
In the
so
clinic.
You can immediately
so when you have coitus and you collect in this special condom, is it something you keep and take the next day, or
no? You have to take it within an hour. It should reach,
within an hour.
It should reach the clinic within an hour.
Okay. All
now,
right.
when you take the sperm, now you look at what we call motility.
Right.
That is
it's movement.
Movement.
Right.
And the movement should be forward and it must be progressive.
Okay.
Sometimes you look at them, they will be at one place and just be shaking.
Okay.
They are not very good sperm.
Right.
Some, they have about 2 heads. They are also not, they should be commented
right.
on.
So the morphology is wrong.
The morphology is wrong.
The form of it is wrong.
Come to the number.
Okay.
The number, well, so to speak, though it's a waste, but well, that is what nature wants.
Okay.
It should be at least 15 million.
Okay.
And that is by definition of World Health Organization.
Okay.
Now, the pH, it should be, we said it should be 7.2.
Right.
Anything beyond or anything before is traumatic to the sperm.
Okay.
So these things are supposed to be corrected.
All right.
And sometimes you will take the sperm and you will see that there is a lot of leukocytes in it. It means that there is an infection.
Okay.
And all these things do.
All right. Great. Let me just quickly treat this. I believe our OB is ready to cross over to the back to school fair. Doc, my testicles are almost always warm, even when I'm sleeping. Very warm to the extent that I sometimes dampen a towel with cold water and wrap it around my testicles. It has been like that since childhood. I have a warm body, but this is always a concern for me so far as childbearing is concerned. Will this affect my fertility? If yes, what can be done about it, please? I'm not yet married and don't have a child. This is from Parkwesi in Adenta.
So you have a warm body. So that is it. No problem. So people are just warm body.
Okay.
But as we discussed the last time, the testis or the scrotum is self-regulatory.
Okay.
It becomes loose when there is too much heat and become thick when there is less heat.
Okay.
To maintain the 30 to 33 degrees Celsius that is needed for spermatogenesis.
All right. So, Doc, finally, if I'm a gentleman listening to you and I'm concerned, I may not even have observed any serious or significant problems, but I'm concerned. Is this something I can just walk into any health facility and seek the advice from a specialist such as a urologist? How should I proceed?
Yeah, you can book an appointment with an urologist.
With a urologist? You don't need a referral?
You don't need a referral.
Okay, right. Would I be required to do anything? Some people say they've gone ahead and done a sperm or semen analysis and so on and so forth. Is that advisable?
So with that, if you have done it already, it means there's a problem. So you might have to come to the general pool, to the clinic, so that you are put in the system. And treatment is started, and everything is observed properly from one stage to another.
All right. Okay. Great. Many thanks once again, Dr. Paul Yegbe, consultant urologist. He's been taking us through the steps, the basics, the fundamentals when it comes to male fertility. We hope you have not merely been informed, but actually been transformed, especially when it comes to our stereotype or stereotypical positioning when it comes to infertility. He's already told us that some of these things, a significant number of them, are caused on the male side. Doc, once again, thank you so much. Many thanks to Abeku Sankofi for the production, and of course to you, my discerning listeners. We go over now to the Providence Center, where the last day of our back to school fair is ongoing.